a full hour now. So thank you to the people who are here in person with us virtually. With the rise of the COVID variant, I know life has been hard on all of us, I'm sure for some more than others. I really appreciate your commitment to building this Master Aging Planning Coalition. I believe now it's needed more than ever to advocate on behalf of older adults in our community as well as the people who serve them, so thank you. For the people on Zoom, we should have closed captioning in place. If we don't, we'll have it in a second. If you're having any trouble with the volume, please let us know. I did send out the PowerPoint in advance. Rachel's going to follow along with me because we have it on the screen here, but she'll follow along as we go, and there's not so many PowerPoint slides. I also sent along the agenda so you can follow along. Rachel, who is our virtual coordinator, is also going to do her best she can to follow along with everything. I'm really taking advantage of her skills because she's a virtual coordinator, not an audiovisual person, but I thank you for doing this. If you have any questions or want to speak up, raise your hand and we'll get to you as soon as possible. Here in person, if you have a question, we'll go ahead and we'll bring a microphone to you. And mostly, I can hear you here, but for the people at home, I think it's important that they be able to hear you as well. And I'll try to repeat the question again, just so that people can hear. But if you do talk, and even on virtual, if you can't introduce who you are, whether you're with an organization, whether you're just a person, an older adult who wants to be here and is interested in the plan, just let us know. So for the sake of taking minutes and notes, you know who you are. Let's see here. So I'm going to go ahead and get going. This is our agenda, which I sent out. So I'm just going to start off with kind of an overview of this coalition plan. And we had a meeting with our leadership team, with strategy, Amber and myself. And one of the things that we talked about was level setting. And level setting simply means getting everyone on the same page or bring one up to speed. And so they all have a basic understanding of the situation or project. And when we leave here today, we should all be on the same page and have a plan in place to lead us into the next quarter. So for example, how we're breaking down our key performance indicators is by quarter with our strategy department, which allows us to talk to you in a second. And hopefully after leaving here today, everyone will understand how we're measuring ourselves and what the goals are for the next quarter coming up. So I think that's good. As far as goals, we want to keep it simple. When we leave here today, besides being on the same page, I want us to establish our committees so we can begin working on them. And just a side note, I usually wouldn't read like this, but for the sake of closed captioning, I'm trying to be under control. Because when I talk to you later from my heart, I'll talk faster and more passionately. So I'm trying to be precise as we start to speak, so bear with me. The main goal that I really want to do today is establish our committees. We have mentioned the 4 focus areas at previous meetings, and they were established when we created the plan. We have social engagement and inclusion. We have complete communities and accessibility. We have superior public health. And then we have community organizations and services. We want a commitment from people on the coalition to begin actively working on one of these committees. So that's a goal. Another goal is to establish how the coalition works, which I mentioned in the email. We would like the committees to meet once a month and the coalition group to meet quarterly. So, for example, this coalition group right here, we would meet together as a group coming up in April. And in between then, each committee would meet once a month in February, March, and then it would come back and report to the coalition group in April. It will be up to the committees to kind of work on the objectives, and we're going to try to keep it simple. We'll talk about this a little bit more, but our goal is for each committee to come up with 2 new goals to work on that we're not working on now. And not goals that are just like you have this great idea about a plan that's awesome. You know, we're trying to stay within the framework of the master aging plan, but we're going to keep it simple. 2 new goals. And one of the examples I kind of used when I was writing my notes was, and this is kind of a fairly vague one, but for complete communities and accessibilities, or complete communities and accessibility, one of the things, one of the objectives that they focused on was outdoor spaces. You know, like at the parks, upgrading parks to be more suited for older adults. Exercise parks, you know, they have them in Savannah and Charleston, different cities. So maybe at one of the objectives out of Tom's group of complete community accessibility is form a subcommittee on outdoor spaces. You know, so we have this subcommittee who can really kind of put their feet to the fire and really start working, collaborating with Wilmington Park or Wilmington City, you know, Carolina Beach, Wrightsville Beach, Castle Hand, kind of bring everybody together. Who are the people we need to have on that subcommittee? So that's an important goal of this committee. You know, get these, or this coalition, get these committees going. And then finally, at the next quarterly meeting, which will be in April, and I kind of brought this up already, we'll want each committee to present to the coalition. So say I'm in charge of the Superior Public Health. I'm going to kind of give an overview of what our committee worked on over the last 2 months. And, you know, we're going to get feedback. People can say, hey, you know, well, what about this? Why aren't you working on that? Or that's a great idea, Andrew. And then the goal is in May, which is Older Americans Month, but it's also a year to the date that me and Amber stood in front of the Board of County Commissioners and asked them to adopt our master aging plan. We want to provide an overview of kind of not only what we've done so far, and you know, from a grassroots level, we've really done a lot, but also where we're going and what our plan is. And you know, ultimately, I think, you know, it's not just about this year; it's about kind of going into the future, the next time. Lastly, with the plan of this coalition is areas of opportunity. And some of these are just catchphrases that I really heard the last time about when we were talking about today. But I love these phrases, areas of opportunity. And when I think of that, you know, I like to say that New Hanover County, as small as we are, we're very resource rich. That doesn't mean like we have all this money, we can do whatever we want, but we have a lot of amazing community organizations, amazing providers. We have a plethora of talented older adults who bring tons of knowledge from different kind of areas. And I really think that we need to do a better job, or I need to do a better job, but as a coalition, we need to do a better job of reaching out and collaborating and connecting to these people and these organizations. Like I would say, the people on this call and just some of the people.
You're not worried.
Technical issues. Oh, I can talk like this.
You want this?
No, I can talk like this. It's fun. Yeah.
Just turn it on. Yep.
Yeah, everybody hear me okay? Yeah. Good thing I don't get it. So where was I at? Oh yeah, but you know, I want to, you know, as one of the leaders of this, and I know it seems weird now because we don't have all the people on virtually. We have about 30 people on it virtually. But I want to bring people together who really want to take this plan forward, you know, in terms of doing things, in terms of advocating, like, for example, Liz, if you don't mind, I'll call you out. I invited you yesterday to come because they invited me to be on a housing advocacy committee. And, you know, I felt like, you know, they have so much knowledge, and like I think about our complete communities and accessibility. There's a big section of objectives of kind of having affordable housing, preserving housing for older adults. Well, one of the things, honestly, like we can't do anything to change that. Like I don't have the power to change that. But as a group of people, as an organization, as coming together as people, we could advocate on behalf of older adults or advocate on behalf of the homeless, you know, anything like that. So I think that's important, that if there's something that we can't do or can't make a change ourselves, like physically do, well then we advocate on behalf of people, especially older adult people. So any questions so far before we move on to our next portion? The questions online, I'll wait a second. While I'm waiting, so the next thing I want to do is do a key performance indicator review. And these are our focus areas. And so I want to introduce Eliza Baldwin. I'm going to give this to you, Eliza, from strategy. From strategy, to provide an overview of key performance indicators that we've established, and not only how we've established, but how we've been performing on them. And so, did you see my PowerPoint this morning, Eliza? No, you have other stuff.
Yeah.
Here's your slide. And I have 4, and I put John's numbers to it. If you want.
Oh, okay.
4 on the 5th side.
Bring it up just a tiny bit.
Is that better? Okay, so my name is Eliza Baldwin, and I've been working with Andrew and his team to help really put together some of these measures that we've identified from the map. And so I'm just going to provide you with an overview, a high-level overview of how things have been going. The group has been really tracking this data since quarter 3 of 2021, which is like July of last year, August of last year. And just for full disclosure, there were some things that they started tracking that had never been tracked before. So in some instances, our starting number was 0. Which is okay, but you know, it's just important that we are starting to take a look at what those numbers are now. And the idea is to look at all of this information on a quarterly basis so that we can really be proactive if we're realizing that some of these strategies or goals are perhaps not performing as well as we originally intended. You know, that's okay. And as Andrew mentioned, you know, those can be areas of opportunity where we're realizing that this idea sounded great on paper, but as we're really implementing these ideas, it's not working as we intended. And that's fine, but we'll notice that before the end of the year when Amber and Andrew have to present to the county commissioners again. So we will be able to pivot very easily, understand where we need to make changes, and hopefully improve those numbers as we go forward.
You talk just a tiny bit slower.
Yes.
Thank you.
Okay, so some of so the first kind of group of measures that we started looking at is related to the social engagement and inclusion focus area. So beginning in the quarter 3 of 2021, when we were looking at educational, physical, mental, and social opportunities, not all of those categories met their target in quarter 3, and that's okay. That was actually the first time that we were tracking that. And that includes, we were looking at attendance of classes that were being offered here at the Senior Resource Center, all of the physical classes that are here. So we didn't meet the target in that very first quarter, but they did meet that target by quarter 4. And then in quarter 1 and 2 of this year, those targets have been surpassed by quite a wide margin. So we're doing really great with the attendance of these types of classes, and I think showing that the targets have been surpassed by each quarter means that we can either grow that target even more, or just know that what's happening now is working very well. Another part of the social engagement and inclusion focus area was related to wanting to start looking at our social media interaction and the Gov Delivery interaction. The Gov Delivery is what they use for their newsletter, and I believe we only started tracking this in quarter 1 and 2 of this year, but so far both quarters have surpassed their quarterly targets as well. For complete communities, we did not have any data related to transportation education in quarter 3 or quarter 4 of last year. However, in quarter 1 and 2 of this year, that target has been surpassed for those education referrals. And I think this is a good point to mention too, that as Andrew mentioned, these key KPIs that we're talking about today are really what can be accomplished here with the staff at the Senior Resource Center. So there's a lot more to this focus area, but what staff is doing here with Tom and his group is that they're working on making sure that they can make referrals for clients for transportation options. But there's so much more. So hopefully this focus area will grow with the other types of targets that we start measuring with the committees. And then for superior public health and wellness, we're looking at food opportunities for several different types of people. We're looking at opportunities for specifically homebound clients. And that's, we look at the home delivered meals clients. So quarter 3 and 4 of last year brought in a ton of new clients. So far surpassed the target there. And then again in quarter 1 and 2 of this year, we brought in a lot more clients. And so again, these targets are being well surpassed. Another measure that we're looking at is increasing food opportunities for those who specifically live in a food desert. And a food desert is an area that's defined by the USDA, where based on a number of different factors, lack of transportation, lack of low income, and then also just a lack of accessibility to getting fresh food, there are these areas that are defined that say that you're in a food desert. So there's 2 in Wilmington. And so what we're looking at here is making sure that people who live in a food desert also have an opportunity to get fresh food, fresh and healthy food. So in quarter 3 and 4 of last year, we surpassed that target. And in quarter 1 of this year, we didn't quite make it in quarter 2. But there were enough clients in quarter 1 to meet that combined target in quarter 1 and 2. So this is another kind of benefit of looking at things from quarter to quarter, where perhaps we didn't hit that target in quarter 1, but we made up for it in quarter 2. So it still shows that we're making progress. And then another opportunity that we wanted to look at was that we wanted to make sure that there was the wait list to be on the home delivered meals list did not exceed 21 days. And that has not happened in the last 4 quarters since we started tracking this information. And then finally, for the community organizations and services focus area, we're looking at volunteer opportunities, and that's kind of a whole, there's a lot in there when it comes to volunteer opportunities, but that was something we weren't quite ready to track in quarter 3 or 4 of last year. But we have surpassed those targets in quarter 1 and 2 of this year. And then finally, the other part of the community organizations and services is that we wanted to increase information related to personal finances and long-term care and insurance by 5%. And that's looking at number of people reached. And again, we didn't have information for that measured in 3 or 4 of last year, but we have surpassed the target again in quarter 1 and 2 of this year. So really overall things have been going very well, and there was, I think in quarter 3 and 4 of last year, since some of this was brand new, these things had never been tracked before. It took a little bit of time to figure out the right method for tracking this information, making sure that the software that the Senior Resource Center uses was being used effectively. But I do feel very comfortable that everyone is, good handle on the data now, and we can start to move forward and really start to measure that progression even more.
Eliza, can you clarify the calendar dates of the quarters?
Yes, so quarter 1 will be January through March, and then quarter 2 would be April, May, June. Quarter 3 would be July, August, September, and then quarter 4 would be October, November, December. Are there any other questions?
You don't have to.
Yeah. We have the information, the specific numbers if anyone's interested.
And I would just add on to that, maybe stay here for a second, just in case, Eliza. Those are the key performance indicators that we created for this first year. With these committees, we can build on and add other key performance indicators. It was just like, there was only so much we were willing to take on to really try to do. However, what I'm going to do now in this next section is kind of talk about how even if some of these things don't, have a key performance indicator attached to them, these are some accomplishments that have come through the Master Aging Plan. And so I have certain people here from the Senior Center who are going to come up and talk. And first, I'm going to have Amber talk about the senior dental services. And you'll see everything that we're doing here is tied into this map, if you will. And it's really giving us a lot of ability to kind of move forward and do a bunch of great things. So, Amber, I'll turn this over to you.
Good morning, everyone. Can you hear me okay? Right, so everybody can hear me. All right. So like Andrew said, we got some really exciting things that are taking place, and a lot of this is a direct result of the map itself. And not only the map, but having our county commissioners support and making sure that we are moving forward with providing excellent services for older adults in every county. And the first one you see is a senior dental program. And this is really exciting. And this really was strongly supported by our county commissioners. Our commissioners realized that a lack of dental services, particularly for our older adult community, is a real issue. Most people may not realize that when someone is on Medicare, original Medicare does not cover dental care services. So oftentimes what we're seeing a lot of older adults who frankly, they stopped going to the dentist just for preventative treatment. They no longer have a resource if they're unable to afford, like an extraction or root canal, things that are causing major issues to that individual. And it's not just dental. You got to look at the implications of what that may cause. We know from research that it also can affect someone's nutrition, nutritional habits if they're having tooth or mouth issues, a social aspect, and also financial. If someone does need some serious dental services, how are they going to afford that if they don't have insurance? So back in December, our county commissioners have adopted and supported us moving forward with a senior dental program. We are working very close with New Hanover County Health and Human Service, particularly our public health department. So over the course of the next 6 months, we will be hiring an individual who will be coordinating this service. We will be contracting with an agency, a nonprofit agency called Access Dental Care. They are fantastic. They are out of Asheboro, and they do have 21 years of service directly related to providing dental care for older adults and specialized populations. We also see that a lot of our individuals who may have cognitive impairments have some challenges of going to the dentist. So with this particular nonprofit agency, they are trained and specialized in providing that level of care. The beauty with this senior dental program is we will have the capability to go to different locations. They have portable mobile equipment that they will set up here, not only at the Senior Resource Center, but we can also connect with housing, independent, low income senior housing or other locations to provide that service that's also accessible to older adults. We are going to be targeting the population that is most needy, up to a 200% federal poverty level. So a lot more information to come, but this is the first of its kind here in Hanover County. Frankly, really in any other region that I'm aware of, that's going to be a public supported senior dental program. So more information to come, but we're really excited about it.
Hold this down, though. Does that work? Let's do this. Yes. Check, check. Hello?
Just hold the top button. Andrew, hold it down.
Hello? Let's see. I'm just testing it right here. Can you hear me okay now? On there? Okay, good. So that's the one thing before I introduce Tom Pacelli, who's going to talk about roads, is, and I wouldn't say that wouldn't happen because this is something that we've been discussing, but having a map and having the Board of County Commissioners commit to us gives us a lot of opportunity to follow through on the programs that we're mapping. And this is one of the next roads. Tom, why don't you come up and talk about this program, which I'm really excited about because we've been talking about this for a few years.
As Andrew mentioned, my name is Tom Pacelli. I'm the transportation coordinator here at the Hanover County Senior Resource Center. At the beginning of the map process, one of the things that I was responsible for was kind of sharing, co-chairing, if you will, the group of complete communities and accessibility. And underneath that focus group, there were three main factors that we looked at. One which was housing, one was outdoor spaces, and one was transportation.
Slow down a little. Will you slow down a little? Thanks.
With me being the transportation coordinator, I felt most comfortable with working on that aspect of this particular focus group and the housing and the outdoor spaces to the other experts. But what we identified with this program was that the number of providers that we have in this area is not able to handle all of the demand that we have for transportation seniors who no longer have that opportunity, no longer drive, don't live in an area where they can utilize public transportation and need some on-demand services. So we had looked at, one of the ideas that we had come up with was to do a volunteer driver program, which is now known as ROADS, which is reliable older adult driving services. So we're going to try and utilize folks that are willing to utilize their private automobiles to provide services to our seniors in New Hampshire County. There were 7 strategies that were determined within this particular category of transportation that need to be accomplished. And I don't want to get into the weeds with that or too much into details, but 5 of those 7 strategies have either been addressed or are being worked on at this point in time. We've taken this information and given it to our risk management group and also to our legal department, and they have signed off on that. So we're in the process of beginning, hopefully within the next 4 weeks or so, the recruitment of volunteers as well as a pilot program, which will take some of our seniors that are currently on our transportation program and allow them the opportunity to work with folks who are going to be our volunteer drivers. Are there any questions about this particular program? This will be a free service that will be given to our folks in the Aarp County. And as I said, it will be a pilot program to start. So we'll identify about 20 folks that are currently on our transportation program. And then we will work with, right now we have about 5 volunteers that have expressed interest in doing this and have done this in either other states or other parts of North Carolina. So we're excited about getting this started. It will augment our existing program that we have here in New Hampshire County, and I think it will provide some much needed relief to folks in transportation in the area. That's it.
Good morning. Are you the contact person if somebody is interested in volunteering for this?
Yep.
Will you share your contact information? Thanks.
That question was, am I the contact person for this ROADS program? And I am indeed. If you want to write down a telephone number, if you have information or would like to be part of this group, my number here at the office is 910-798-6413. And I'll be more than happy to talk with you about the program, being a part of it or working towards getting the rest of these goals accomplished. The last name is spelled P-A-C-E-L-L-I.
Will you say out the abbreviation one more time?
Okay. The abbreviation ROADS is reliable older adult driving service. Are there any other questions? Oh, there's one back there.
What is the liability issue for someone with their own private vehicle?
The question was, what is the liability for someone using their own private vehicle? What we had determined was that basic, Orange County is kind of the format that we had used to try to get this started. They are running a very successful program. They require just basic minimal insurance. We are asking for upgraded insurance. That's what our risk management had asked for. So we are going to require that they have more than, right now it's 100, 300, and I think 50, and we're going to be requesting that it be upgraded. It's going to be a little bit of additional cost for the people that are driving, and we're going to see if we get pushback on it, then we'll perhaps maybe need to make adjustments, but it's going to be more than the minimum is required by North Carolina. Are there any other questions? Thank you.
Great, thank you, Tom. And I'm so proud of that, just because everybody knows in today's climate, whether it's restaurants, transportation, and care, a lot of people are having employment issues where there's not enough providers out there. And so thinking outside of the box and actually just being the plan before it became like really a necessity is so neat. And to have volunteers currently, Cody's going to come talk we have over 400 volunteers here at the senior center volunteering already.
Yeah.
So we have a very vibrant program, and this is just another amazing additional program. So I'm going to call up Rachel, and I'll try to manage the lines.
Thank you. I'm gonna stand here since I'm testing on this screen as well, so I apologize about the podium, but I hope this is all right. We're gonna see if it works a little bit better for our guests online. Like Andrew said, my name is Rachel. I'm a volunteer. No, I'm not. I'm the virtual service coordinator. I volunteer in my mind from the previous mention. Anyways, I'm going to talk about OATS. We are going to begin a pilot program. Older Adult Technology Services is the full name. This is a pilot program that's going to be provided through Senior Planet, which is a part of AARP. This program is a licensing program that the Senior Resource Center has been granted. This will be a 1-year free program where we will begin providing technology classes to older adults at no charge here at the center. What's interesting about this program is they are going to provide all of the training for staff members who will be instructors, as well as volunteers who are interested in teaching the classes. So we will begin providing these services in the springtime. What's great as well is that we have all of the materials given to us. Senior Planet will be providing all of the instruction, all of the PowerPoints, any kind of materials needed to teach the classes will be given to us. We do have to provide the devices, and we are currently in the process of obtaining those. All of the devices will be the same, so when seniors come to the center to take the classes, everyone will be on the same platform. So we won't have, a couple people on Macs and a couple people on Dell or HP. Everyone will be on one platform. We will then teach the classes. They're about 75 minutes. And what's really cool, I'm excited about this part, is the classes are not your standard how to create an email address. These are classes that will really enhance older adults' experience with the internet and with technology. So it's things like how to use Facebook and how to use Facebook Messenger, how to use other social media platforms, how to create your own Etsy store to sell your beautiful hand-knitted scarves. It's a wide variety. They have over 70 programs, and they're continuously enhancing their quality of their programs as well. So they're adjusting as technology adjusts. So the programs are going to continually change. So as new social media comes out, as new platforms are improved, our technology classes will follow along with that. So we're really excited, we're looking forward to it. Right now, we're in the process of completing the paperwork and the background information with OATS to begin providing the services, like I said, in the springtime. So our volunteers, as well as staff, so myself, Kelly Morgan, and a few others at the Senior Resource Center will go through the training process. It's multi-week process training, as well as a teaching session where we will go through and learn how to provide this technology to the liking of others. So this is something that they give us everything we need, and we will learn how to do it the way that they would like. Like I said, it's a 1-year program, and at that point, we will then review the output of the programs that we provided, the quality, and how we feel it was best received by our seniors, and then make a decision on if we'll continue providing it in the future. So this will be an April to April program that we will be providing. Any questions? Thank you.
You'll see that message from Steve right there. So let me come back over here, Rachel. Your camera. One of the things before I start talking about the mental health is all of these programs are kind of grassroots from the Senior Resource Center, but when we flip it, I talk about the opportunities section. That's going to be where we're going to expand out, if you will. We'll get to that in a second. So the last thing on here is mental health services, and in, I think it was Superior Public Health. I can't remember exactly what the objective was, but one of the strategies is kind of to address mental health issues for older adults. And probably, some of you, there was an article in the paper yesterday, but it was probably about 3 or 4 months ago, we had someone who was lying on the street and, you know, had substance abuse issues. And actually, Tom was with me that day, and we brought the person in here, and the person said they needed help. We brought them to the room, and we were real thoughtful and caring, and we talked them through it, and we were gonna call mobile crisis, and mobile crisis said, well, we can't come, you need to call the hospital, and so we said, okay, we'll call the hospital since you're the crisis unit, but you won't come. And then, you know, eventually the guy wanted to kill himself, and then he got a knife out, and it got really crazy. Luckily, me and Tom were able to talk him down. We actually got him to get into the ambulance, but we didn't have the skills to do that. So, you know, thanks to the American Rescue Funds and Florida County Commission, we were able to hire 2 licensed clinical therapists here at the senior center. And probably the first one we hired was in October, and we recently just hired another one. The great thing about this program is there's no cost to it. So anyone can come to the senior center, and you know, we're building the program from scratch. So right now, we're currently building standard operating procedures, caseloads. We have software we're using. We're kind of following the model that Health and Human Services did in the schools, in the county schools. But we're also creating our own program because it's dealing with older adults. And just a couple of highlights, you know, already one of our therapists already not only seeing people here at the senior center, she's had some clients, but she started a group therapy program. And this program is exciting. I know we have some AARP people in here. When I was at the national, I wasn't at virtually, I was virtually at the national conference. There was a program upslide from the senior center in Tallahassee. And it's, I can't tell you the whole acronym, but it talks about dealing with, you know, social isolation and loneliness among older adults or the elderly. And so we reached out to that lady, or I did, and we had this awesome conversation. And I said, hey, so we use your model for this program, which is like 180-page, you know, book. She was like, yeah, there's no licensing to it. I'll send it to you, and here you go. And right away, Louisa, one of our licensed therapists, started that group therapy program. Another aspect of this program, which is amazing, is we can go to people's homes. For homebound older adults who can't get out, we can actually go. And again, Louisa, who's been here a lot longer than our new licensed clinical therapist, she's taking the bull by the horns, and she's already making home visits to people who are either afraid to get out or they can't get out. And that's an amazing service to have, because you know it's not easy to have a therapist come to your home. And then think about the ability to go to a senior housing place, a place like a HEPA, if you will, and be there for the day, and meet 4 different clients that they don't even have to leave their home. So it's really important to me. For being here 6 years, I've seen it more and more grow. Then we had the pandemic, and then that just kind of exacerbated everything. But if anything, it highlighted the fact that, you know, there's a lot of older adults who are socially isolated, and they're by themselves, and they're not getting out. So we're really excited about that. And then just to speed things up, Amber, I may go ahead and not skip through this, but I may just kind of go through this. Yes, we have a question.
We're gonna talk a little bit about the volunteer map.
Oh my God, sorry. Totally.
Don't worry.
No, I am worried because I skipped you. But I added this on last minute. Coley, I asked him to do this kind of on the fly, but this is a really important aspect of today's meeting. That's why I added Coley on pretty much 24 hours to 48 hours ago. And he's doing something amazing that's gonna help us build this coalition through volunteers. So sorry about that, Coley. Any questions about the mental health before I turn it over? Sorry, I didn't mean to skip there. I don't have my glasses on.
Hi, I'm Ellen Bryden, and I'm the one that is totally focused on caregiving. So I'm hoping that this committee will be talking about the caregivers, preparations for caregivers, when people come out of the hospital, connecting with hospitals, and then when they're kind of senior oriented. I focus on the seniors, but anyone who is bringing someone home from the hospital, wondering about meds, what do you say to the doctor, how to get your patient or your loved one in the car. When you're out of the hospital, you're out of the hospital. And it's good luck to the caregiver. So I really think a focus on that would be good. And I'm hoping that a lot of seniors who have that experience will be part of that project.
And I'll come back up here, and Ellen was just talking about the idea of focusing on caregivers, which really falls under, in terms of the master action plan, the superior public health. And it does address caregivers, and honestly, here at the Senior Resource Center, that's one of our big programs. We actually have a family caregiver support program, which we focus on respite, we have support groups, we provide education, we have a partnership with the diaper bank, but the idea of expanding education and supporting caregivers is something dear to our hearts, and I'm sure, a lot of people in our community who are caregivers would like to get on that, but that's part of the master action plan. So Ellen, it sounds like you're part of that superior public health. I think that's the work group you were in anyway, wasn't it? Yes, so that's gonna be a big focus, and maybe that's one of the areas, the two goals that we have for the committees that we'll talk about, that we want to expand on in that group, and kind of, whether it's education. And think of how many great organizations we can partner with who deal with caregiving, whether it's the Cancer Society of America, ARP, the Alzheimer's Association, Dementia Alliance, Lower Cape for Life Care. I mean, there's a lot of possibilities in hospitals, which, we really have built a great partnership with hospitals. I actually had 3 resident doctors in here this morning. I gave them a tour of the whole senior center and was really educating them about what a multi-purpose senior center is, because they didn't realize that we do caregiving support, we have nutrition, we have transportation, we have volunteers. It was blowing their mind that we do taxes here for anybody 18 or older. So yeah, that's a great point. Any questions on there before I turn to Colin? Okay, thank you. And sorry, Claude, I took off my glasses, so I really can't see.
That's okay, Andrew. Thank you, everyone. Hi, I'm Colleen Shelton, and I'm the AmeriCorps Senior Program Manager. And so my position and the team that we work together to manage the federal program, the RSVP, so that's the Retired and Senior Volunteer Program. So as Andrew mentioned, we have more than 400 volunteers in that program here in Hanover County. And then we also help to support the foster grandparent program. So we have 40 volunteers who are at Hanover County schools, community organizations, and they're helping to support students that have social and emotional needs. And so those volunteers, as well as the RSVP volunteers, are part of the work that we do. And so Andrew and I have been talking a lot about how can we continue to recruit older seniors to contribute and be a part of the MAP program. And we've been talking about then recruiting additional volunteers that may come from our RSVP group of volunteers who are already involved in some capacity and or reaching out to new volunteers. So we invite you all to assist us in talking to friends, neighbors, colleagues, professionals who you may know that would be willing to continue to contribute. And then those of you who are online as well, we're going to share that information. We're developing a job description for the volunteers so they have an understanding that they're going to be asked to participate in these meetings, both both here in person or virtually, that as part of the process, they can then assist us too in connecting older adults with the MAP program so that we can have a well-rounded involvement. And so as part of that, we're gonna work to have those volunteers be a part of the subcommittees that we're talking about today. And so again, please feel free to reach out to myself and just let us know if you do have somebody who might be interested in the opportunity. So we're gonna share more as we develop it further. So thank you, Andrew. Thank you.
Great, and hopefully, Mildred, I know you asked me about volunteering earlier, and that program is specific to older adults. Of course, we want all kinds of volunteers, but I love how we're gonna focus on kind of recruiting not only older adults, but people who have skills that they can bring to the table. But the biggest thing is committed and going through the volunteer process with RSVP, which is Retired Senior Volunteer Program. I think will really kind of get a strong commitment from the people who sign on. Any questions about that? Before, I just wanted, a couple of these things I'm gonna hit on real quick that kind of are related to the plan. I was gonna have Amber talk, but I'm gonna speak through this, Amber, is eliminating the home delivery waiting list, which was part of kind of our key performance indicators. Right now, active clients, we have about 590 home delivered meal clients right now. We're probably averaging a little over 500 meals a day, because some people are on dialysis, they're on hold or doing something else, but that's a lot. Virtual programming coordinator. I wanted to highlight that because our outreach has been so much more extensive with the addition of Rachel. It's really expanded what we're doing as a senior center. Amber always talks about a senior center without walls all the time, and we really are extending and partnering with community partners like the city at the pool or the tennis courts or Baines Park, the Davis Center. We have 2 new nutrition sites, one at KB Hines, Carolina Beach. So just a lot of exciting stuff. And then lastly, I kind of put communication in there with that virtual program, but lastly, the added recreation programs and exercise programs. I've been here for 6 years and we are doing so much innovative, great programs. Like with one of the grants, we actually have certified trainers coming in here. You see the balls around the room. I know the people at home probably can't see it, but we have a Drums Alive course that people do here. We have an extensive gym that, yesterday I was showing someone else. I think I was showing you, Dylan. There was like 10 people in the gym just going after it, getting healthy, and it's really impressive. So I wanted to skip over to kind of, I forget, do you remember the phrase I said, Amber? It was like, it was real negative that I had. It was like weaknesses. It was improvements. What we needed to improve with the plan. And Amber, she kind of looked at me and said, opportunities. And I was like, oh, I like that a lot. Not weaknesses, opportunities. And I think because it's a grassroots thing and we've been doing it here, we haven't really built these committees yet. We have opportunities. So I just picked a couple because when I went through the plan, we have so many. You gotta remember, we have 8 goals. We had 25 objectives. We had like 99 strategies that we came up with. It was like almost over the top. However, I picked out like 3 different slides, and for the first one, it looks like we talked about creating and expand skill and knowledge-based programs for older adults and incorporate opportunities to connect intergenerationally. And that's something that we do every now and again, but it's something that doesn't happen here. I think we have the university. We have like the high school behind us. We have the Cape Fear Community College. As a community, we have the Bush Lifelong Learning Institute. We need to learn to coexist, and we would be lying to ourselves to say that there hasn't been a little tension between the older generations and the younger generations nowadays. So how do we get to better understand each other? I did a presentation at Osher about intergenerations, and it was interesting to get perspectives. But you know, one of my best buddies was 99 years old. He died like 4 months ago, and he was just such a influence on my life. But then I met a lot of young people who they bring a lot to the table and they get it done. And you know, you can be young or old and do amazing things. So we have to learn that. Another thing is plan for additional accessible space to accommodate creating learning opportunities. We're just one senior center, you know, we have to get out to the community. I'm not saying we need to build another senior center right away, that's maybe not feasible, but I know when Amber was looking to extend to the south, to start a new satellite site, that was a hard process. There weren't many people willing to kind of take that on. So how do we collaborate with more organizations, maybe like the hospital or whoever, that kind of really extend services to different areas in our community. Last thing on this one, just connect with leaders in underserved communities. I think, you know, we already started a diversity and equity or department here at the county, and I think Wilmington, they just had Joe Conway, who became the head of their diversity and equity. So we're excited. We did some amazing stuff during the pandemic, getting out to homebound older adults and getting them vaccines. That was huge. I don't know the exact number we served, but we were on the phone calling for like 2 weeks straight, and still now to this day, I got one yesterday that someone's like, hey, can I get my booster now? In the health department, you know, in the office of diversity and equity, they get on it. The next area, let's see here, I'll look at the slide, is the affordable housing and outdoor spaces. I kind of put this up here because this is one of those things that I brought up earlier, like we don't have the capacity to do anything about affordable housing. We get calls 6 to 10 times a week of someone saying, hey, someone told me to call you for housing, I need senior housing. And it's not so easy to get anybody connected to season housing or senior housing. There's a 1 to 2 year waits for a lot of affordable housing. And when I say 1 to 2 year, I mean 1 to 2 years. It's hard for, you know, a lot of women who only have one income to qualify to be able to rent an apartment. So this is a big issue. So how do we tackle this? Well, we have to have people who are experts on housing, part of that complete community accessibility, who can connect to the people. Like Tom made a great point, like he's an expert on transportation. He doesn't know many people in housing. So who's going to be our housing advocate? Who's going to connect us to more housing advocates? And how are we going to kind of do whatever they want us to do or recommend to help kind of make sure we add senior housing or preserve housing or have better spaces. So that's that. Let's see, last one I had in here, community organizations and services. I had this one in just because I originally oversaw that. And one of the things that I think is huge is part of that committee is creating this coalition. I think that's huge that we have to build that, and that comes from the whole community. But another thing from that is a resource guide. A lot of people in the community needs assessment wanted an active community resource guide. And I can tell you that Area 8 County AG has one for older adults. But as much as it's an awesome resource guide, it's kind of geared more towards caregiving and the medical side. How can we create a comprehensive, community resource guide? And this is just one idea, but imagine having volunteers from one of the committees, from the community organization committee, who actually maintains it, a volunteer. Because if you've never done anything like that, it's hard to keep businesses closed, supervisors change, it's not an easy thing, but it's something doable. And we keep stuff updated all the time, but if we try to publish it, it'll be out of date in a second. So that's something that's important, and then, you know, establish effective pathways for older adults and people that serve them to secure fairly compensated employment, including traditional alternative options. Well, I think I saw Steve on there, but me and Steve, I know we're both, everybody's like flying by the seat of their pants because of short staffed and you're wearing multiple hats. But we talked about, at least here at the senior center, where the United Way and CSEP, they provide older adult workers here. But we talked about actually having a worker here through United Way focus on employment for older adults, helping them, you know, do their resumes, provide training, getting jobs. And that would be great. Me and Steve have touched on that. But then I also think about the home care worker. Ellen, you brought up caregiving. People who have the most important jobs in the world are not getting paid enough money. We have money that sometimes we can't spend because the home care companies don't have enough caregivers to provide support to a caregiver who's dealing with Alzheimer's or another related dementia. So how can we advocate on behalf of those people? I know organizations like AARP does a lot to advocate on part of caregivers, but how do we do that locally? Like maybe something happens through the hospital. I know they gotta have their own caregivers, but I mean, how do we come together as a group? Because coming together and just charging more money for the home care companies, that's great, but that's not necessarily going back to the workers. So that's just a couple of different opportunities we have. And then we really have a lot more than that, but that's where these committees come in. So any questions before I move on? Because this is like the crux of the meeting today. Yes.
My name is Teresa Dennis Moore. I'm blind. None of us can I see. No one has addressed visually impaired people. I've heard you say, I can't see without my glasses. I can't see without my dog. People have this strange thing about people who are visually impaired. My eyes aren't crossed if I'm not standing at the window. I don't have this glazed look. You possibly cannot. That's not true. We have 100,000 people in the state of North Carolina visually impaired, and then 50,000 are outstates that are not being addressed. I've had my dog 3 weeks and didn't realize how much I needed her. I'm a caregiver. My husband had a stroke and I'm dying. I'm a retired home health hospice. I've been to Africa, I've dug wells, I've worked at the United Nations. I go everywhere, and I'm certified. Yet I come to the senior center, and there's nothing I can do. I couldn't get in the bathroom because the hand is over there, and I got to find it and run to the bathroom. My husband's in a wheelchair and he can do the same. I'm here to advocate for all of those people who are sitting in their homes now that can't get out because nobody understands visually impaired. Thank God for this wonderful dog. We are the only team, we are the only dry-eye team in Wilmington. She's not an emotional support dog. There's nothing wrong with that. She's not an assistant dog. My son has PTSD and other issues, and he has one. This dog is remarkable. She can go anywhere and do anything. She puts her feet on the curb so I can see the curb. She gets me across the street. She doesn't engage with people because if she does, I might go in the wrong direction. When she's in harness, she works. When she's out of harness, she plays with my border collie and my cat who doesn't like her too much. But I came today because I was aware of so many people. If you wear glasses, you're visually impaired. Take off your glasses. Try to see. You won't see as well. So I hope in some way, Nari and I can give assistance to all of you and to Impaired.
Thank you, Teresa, and, you know, that's part of the plan. You know, when we made the plan, we had someone from, North Carolina Line Services, and so,
Andrew, can you reiterate what she said, please?
oh, yeah. I think, you know, really what Teresa was saying was she was advocating, you know, on behalf of all people with visual impairment. And I feel like Teresa was saying she wasn't really satisfied with, you know, the options that we had here at the Senior Resource Center, which is, it's fine, it's something that, no, it's, you know, that's how you feel, and that's perfectly fine. It's, you know, when we had our pandemic, we had to modify the senior center. At the time, we didn't really have ADA compliant bathrooms because back then when the senior center built, it wasn't accessible. Now we do have things like you could wave a door and it opens and there's more room to get into a stall, but that's what we're doing. We're still trying to work, and that's why we reached out to you, Tom, I know reached out to you and wanted you to be here, and we've been working with North Carolina Blind Services about support groups, about helping possible do transportation to get people to support groups. So that's wonderful, and that's what the plan about. We'll never say that, you know, or I'll never say that I'm an expert at anything or I do anything great, but when you get feedback, all you can do is take feedback and you can work on it. And that's what the master aging plan is. It's a 5-year strategic plan, but it's not just for 5 years and it's over. It's for the next 5 years and the next 5 years. And, you know, you can't solve everything at once, but, you know, we'll take that information and I'm sure everybody on the call is going to take that information and we'll do better. But that's what it's about. That's what it's being on these committees. And so we have 4 committees, and I think everybody knows, you know, the first one's social engagement and inclusion. And just to tell you how it's set up is we have a co-chair for each group. Like you can see, actually we have 2 for this. We have Amber Smith and Kelly Morgan, who's not with us today. We would like someone from the senior center, but we would like someone from outside the senior center co-chair each one of these committees. And we want someone from outside the senior center who brings something to the table from that group who's going to be committed. And of course, we want people working on that committee. But in terms of social engagement, you know, it talks about physical and digital accessibility, facilities and community integration, promotion of awareness of programs, getting feedback from older adults regarding services. Like that's a perfect example. Like when we did a community needs assessment, you know, we got over 1,200 responses, and we did, you know, 48 key informative interviews, and we had 10 focus groups. So the plan was made out of feedback. So how do we get better at asking feedback or connecting to the right people, the right demographic of people, whether it's, you know, low income, whether it's visual impairment, hearing impaired. We have a great connection with the Disability Resource Center here at the Senior Center. Like, how do we connect to more people like that? Opportunities for intergenerational engagement, access to service and programming regardless of ability, socioeconomic status, race, gender. I mean, this is all wording in the plans, and it's, you know, up to these committees to act. So as I go through this, and I'm going to try to do it in a timely fashion because we're getting close, I want each one of you to think about it, about, is this a committee you want to serve on, and what do you have to offer to this committee? And I really want to get a commitment, whether it's, you know, on paper, in this group here, or virtually online. The next one, let's skip it here. Let's go. Is complete communities and accessibility. And, you know, without going too far into it, this one focused on transportation, housing, and outdoor spaces. So, you know, I see people who have infrastructure experience, outdoor parks and rec, transportation, housing, planning. A lot of different people can focus in this area. Anything else I'm missing in there, Tom? Good. Superior public health and wellness. Now, this is probably, Ellen, who was our wonderful nutritionist, and Dylan Donnelly, you can't see him on camera in the back, but he's new. This is his third or fourth day. But she retired, she moved to Colorado, but she helped lead this group with Sarah Offler from the Aarp Regional Medical Center. And they really tackled a plethora of stuff on there. But anything from mental health, you see healthcare providers, caregivers, and patients provided with adequate education on aging, programs and services to improve caregiver support. I mean, that's a major factor. And like I said, from a senior center standpoint, I'm 100% proud of everything we do for caregivers. We do caregiver luncheons to honor caregivers. We provide respite. I spent 4 hours on the phone 2 days ago talking to 3 different caregivers, providing support and resources. But that's just us, so how do we extend that to where people know about that? They get that from the hospital, or if someone gets diagnosed with Parkinson's or dementia, someone's providing that education, and we have to do that as a community. But then, there's a nutrition factor, there's access to medical care, emergency planning is huge. We oversee the special needs registry here at the senior center. But when usually a storm hits, and as most of the people in this room know, the storm usually hits, who's ready and who's not ready? How do we educate the community? One of the things that we're really pushing for, I know Amber's pushing hard for, is to have a position in emergency management dedicated to overseeing that special needs registry. So we can really get out there and do community outreach and educate people how to be better prepared, because that's what it's about. So, this is a group, I'm taking over this group because a lot of it is near and dear to my heart. But there's a lot of work to be done in that group because superior public health, that's huge. And then lastly, I did forget Coley earlier, and I'm sorry, Coley, but Coley's taking over the community organizations and services, and I'm gonna have some kind of allegiance to this too, because I kind of helped form this group, but I think this is like our biggest strength is collaborating as a community and working together. Like during, I think it was Florence, and me and Amber talked about this a lot of people were doing the same thing, they didn't know they were doing it, and they weren't working together. Then someone came up with this awesome idea to start like this Hanover County Food Coalition. We started having weekly meetings, and they weren't anything amazing. We talked for an hour and said what we did, and somebody would have said, "Oh, you're doing that? Well, we're doing that too. Where are you doing it?" And we started kind of getting on the same page. And that's how I kind of see this coalition with the help of like a committee like this, where we're really trying to work with each other and educate each other so we know what we're doing. So if someone comes to me and goes, "Hey, I need this and that," well, I know that the Disability Resource Center helps with this and that. Also, I love the idea about some of the stuff in the technical support and literacy, the education, which we're already doing here, but how do we get that to the people in downtown, or the people on the north side, or the people on the south side? How do we have a community resource guide that someone knows where they can look at? Because how many people here, maybe because some of your providers, the area agency on aging has a resource guide, but does anyone in this room really know that they have a resource guide on their website? So anything else? Provide partnerships for intergenerational partnerships, and maybe that's something that in my mind I thought was important, but it was actually out there in the community needs assessment, because I feel like there's a lot that older people and younger people can do for each other. There's a great program at the University of Kentucky. They have an intergenerational program where there's an Osher Lifelong Learning Institute there, and the older adults mentor college students, and they kind of go hang out together at the house. They meet, they have a couple meetings, and it's a simple kind of just friendship that forms. But you know, why can't we do that here? Especially if we can all get on the same page and will help improve quality of life for everybody. So that's my overview of the committees. I probably could have went into detail, but a lot of people on this call probably served on one of these committees or know about them already. There's maybe some who don't. So any questions? Anybody? No online questions? So my action items, establish committees and set first meeting time for February. You know, probably this first meeting in February, it's potentially could be virtual. I know my friends over there, they don't like virtual. But it could be a thing where, because it's a smaller group, we could meet in person. But I'm gonna let each committee chair kind of dictate that, kind of reach out to the people who commit today. And I really want people to commit today. Like, if you could do it online there, if you don't feel comfortable picking something, you need to think about it, reach out to me by the end of the day by email and tell me what committee you need to be on.
We do need a brief description along with the titles of each of them. Some of them are having a hard time with the audio, so if you could send a follow-up on that,
Yeah.
so people can review and then send it to you.
And honestly, just a question to the virtual people, how many people there have seen the master aging plan? Most people.
I've got a few people that have raised their hands.
Yeah.
Mhm.
Well, I can say that the people in this room and the people virtually, that this stuff right here is taken directly from the master aging plan, which is on our website. So you can go to the website. You know, if you came to one of these meetings earlier in person, you have a hard copy. But this is the direct, I just took it from the titles, like each group kind of made an overview or came up with a little, you know, kind of statement at the beginning of what this focus area represented. But within the plan, we also just kind of took, you know, what was highlighted within the goals and objectives and strategies. So that's directly from the plan. So it's nothing different. So I don't know, I can give you an overview, but I would just as much rather you go ahead and read it. And you can read it, and you can go to the New Hanover County Senior Resource Center website, and there's a map section, and you can get a copy of it and you can easily read it. And I think that would be the best, if that's okay with everybody.
A follow-up would be preferred, but somebody did put the link in there for that so
Yeah.
that they can review. But if you could send a follow-up regardless, that'd be good.
Oh, a follow-up email? Oh, yeah, well, I'm gonna definitely send a follow-up email with, Rachel has been great about recording, you kind of send it out, because I had a couple people due to COVID or another appointment that they couldn't be here today or be on. But I will make a request, like I made a request last time about a commitment, I got about 13 commitment forms, which is, it's great, but I mean, I know we have more people who are committed. We just didn't get the forms, but if we want to hit the ground running and have 2 meetings, you know, in February and March, and then come back to do a quarterly meeting in April, then we want to set the groups. And if you're not committed, that's okay. Like you know, that's okay. You may not have the time. I'm well aware, you know, of time restraints. But if you're on the committee, then we want to get together, and we want to get to work, and we want to recruit. I guess the next action item of, you know, of this is recruiting volunteers and providers who want to actively serve on the coalition. And you may be an expert, and I'll use Tom, I keep on picking on Tom, but Tom probably knows what other transportation people we need to have on board. Kelly probably knows what volunteer people need to get on board. And I know a lot of people, I gotta do a better job of reaching out to them and getting on board. But I think that's important. And then I just kind of reemphasize commit, like there's a bunch of great people who helped us write this plan. I think we had, 70 people, Amber, on that master agent plan. You know, if you want to get involved, commit. And if you can't, if you just want to be on the coalition to hear what's going on and give ideas, that's perfectly fine too. You are not committed to being on one of these committees, but we want to form these committees so we can kind of come up with new key performance indicators and come up with new objectives. Like just, Teresa, every time I look at you now, I'm thinking, how am I going to let Teresa, how can she hear the master agent program? She can't read it. How's she going to hear it? How are we going to?
I remember a lot of things, honestly.
Yeah.
It's a good memory.
Yeah, but it's an expensive plan.
I'm not totally, but I do have some vision.
Yeah.
So.
Yeah, it's an extensive plan, but we want to make sure it's out there and hear it. But if you don't mind, let's see here. If you don't mind the people in the room, did you pass around that sign sheet?
Right here.
If there's some committee you want to be in, like I probably know Joanne wants to be in Superior Public Health, because I know that's important to you. That's what you put down. If you're kind of questionable, put questionable. People online, like I said, if you're gonna put it in there, please do. Are you getting any putting it in there?
Yeah, I opened a Word document. I'll make note.
Nice, thank you. And if you feel like you need more information, I will follow up, but also you can reach out to me. By phone or email. I do have a caregiver call at 11 o'clock. Caregivers. So before I close, for the greater good, is there any information that anyone wants to talk about or promote? Because another thing about this coalition, we have so many organizations and providers, I feel like it's a good opportunity. Of course, me and Rachel, by the next meeting, will figure out how to get the people online out here, so you can hear them, but anything you want to promote, anyone in this room, and then anyone online? Yeah, no upcoming events. Anybody online have anything they want us to push? Rachel?
There was a question earlier. Ed would like to know where on the agenda of this meeting could we discuss the concept of making New Hanover County, Wilmington a blue zone. Blue zones have been adopted as an organizing overlay in Transylvania County, North Carolina, and other places approved by the U.S. Conference of Mayors. Do we need to set up a committee to report?
Ed, that's awesome. First of all, because I love Brevard, Transylvania County. I went to college there. I think blue zones are amazing, and I think that would definitely kind of fall under that nutrition aspect of superior public health. So yeah, that's something that we need to discuss further. And so hopefully, if that's something you're really interested in, it, then we get you on the committee and we start focusing on something like that.
Mitzi said that she'd like to work with the intergenerational programs and has lots of volunteer coordination experience. Which committee would that be?
That would be the community. Actually, it's weird because it's community organization services, but it also has social engagement and inclusion. It's kind of been there both ways. So Mitzi, you may want to go ahead and just kind of review that. And I'm excited to have Mitzi on board. For those you may not know her, but some of you may have worked with her. She's retiring in June, and she's officially moving down here to the area. So she's excited to be part of the coalition. Congrats again.
The AARP volunteers will be talking with you. They'd like to serve on all 4 committees.
Oh, that's wonderful. Thank you. Anything else that we could think of? Well, I appreciate everybody taking time out of your busy schedule. It's been a crazy couple of weeks for us here at the senior center. And I'm sure, like everybody else, we're persevering and we're being resilient. Well, you had a question?
Yeah, Joanne had a question.
Yeah.
Yeah, my thoughts about this virtual. Do you think this is going to be an ongoing thing for committees? The committee of, I'm interested in health and wellness. If this committee is going to continue to be a virtual situation. Ongoing, the monthly meetings. Is it going to be virtual or you don't really know?
Yeah, Joanne, I couldn't honestly say yes or no, just because, we had a bunch of people who are virtual today who probably would have been here. And it does make it more convenient for people, but also some people feel more safe, not having that contact. And I'm not gonna judge anybody. I'm a people person, so I hate it, and probably Rachel agrees with me. We don't like having to deal with the virtual online aspect of it.
Well, I do. That's my job.
Oh, yeah, I guess you do like that, don't you? Well, I don't like it at all. I like being in person, but, we've had to just adjust for the time, so, if depending on where you get your news from, everybody gets together and we all kind of get this and get by and it dies down. That'll be great. They've been saying that for about a year now, so, I don't know, every time when you feel safe, it's not safe anymore. So I don't want to make any promises because, it is hard to have half the people there, half the people not there. I can tell you, I'm not probably putting anything out there when I'm virtual. Sometimes I'm not fully committed. If I'm on a computer, I start multitasking, where at least if I'm physically there, I can look someone in the eye and kind of know that we're engaged together. It's different to me, but I'm still not gonna ever, we want to be, we're talking about being accommodating and accessible as part of the plan. So I want to do that.
Yes.
Yeah. Sorry.
But I'm just wondering about February.
Yeah.
And do you think?
She was wondering about February. And again, I'm gonna leave it up to each committee chair to kind of make that. And I'm gonna make that decision this week just on what's out there, what information's out there and what's best. And who's on the committee and what they're comfortable with. If anything, as your committee, as a chair, if you reach out to your group, you can that's one of the things you could ask them is, hey, would you be okay with in-person or virtual? Yes, Teresa. Yeah.
Whatever committee I'm on, my home is large enough. I am not afraid for any of you to come and be there in person. I'll scrub and we'll have hand sanitizers and the ones in my bathroom, you just put your hands under. So you're more than welcome to hold a meeting there if you feel more secure in doing that.
Thank you. And what Teresa was saying for the people at home, she was offering up her home, thank you, to hold a committee meeting in her house. Anything else online?
Kat said, thank you for your sensitivity to the feelings of others in this regard. Ed said that he injured his knee yesterday and would not be present if virtual was not an option. And then there was just discussion on how many groups to commit to without overcommitting.
Yeah.
Brittany said she was originally on 3.
Yeah, Brittany was like a workhorse, which I really didn't want people on multiple groups, but I can understand how somebody wants to if they're committed. that's really up to you, and if you have the time. We're taking this slow, we're doing once a month, we don't have all these subcommittees yet, like ultimately I could see 4 years from now, the Complete Communities and Accessibility has 3 subcommittees off their group, that's how a lot of coalitions and advisory boards work.
What is the process to bring in new members of the coalition? Leslie would like to know.
Thanks, Leslie. I would definitely, have them reach out to me. When Mark, me and Mark, we talked just, about a housing issue, but then we got together and talked a little bit about, the master aging plan and what it consists of, and at least. He signed up for the public health, but at least, I could give them a good overview without, a one-on-one, which I think I do better at anyway. So, yeah, just have them contact me, and I would love to, connect. Ellen?
I'm wondering whether, this is going to be part of the structure, so maybe I hadn't get here, is the communication on what each committee is doing. Can I get a short report after each meeting so that I can see, well, this committee is doing that as well, or connect here, that sort of thing.
Well, that's wonderful, and she was talking about, after each meeting, is every committee gonna provide a report? And I think that's essential for those committees to kind of document, take minutes, but how I saw it, how the structure was quarterly, every quarter, that committee was to come back to the aging coalition group and provide that information, because it's hard to keep up with every month. At least they can kind of do that and put something together and then present it to the coalition.
Because if there's something, oh, they're tackling that, so are we, so maybe we can connect together.
Yeah.
It doesn't have to be a limited high points, but
I like that, and the great thing about having at least one person from the senior center on each group is will be connected, but I love it. I have one of my new clinical therapists, she writes me notes of everything we talk about, and at first I was like, what is she doing? But then I was like, oh, I got to go over everything we talked about, and it kind of keeps me on task, and I keep them on task, and now I like it. I'm like, hey, give me the minutes from our last meeting so I could figure it out.
I'll volunteer.
Yes, she said it's all volunteers, and I don't expect much, but I expect everything, because yes, yeah, our place runs on volunteers. Earlier this week, our whole kitchen staff was volunteers, literally. So anything else? No? Well, thank you everybody so much. I know we're a little bit over, but I appreciate your commitment and for being here, and thank you so much. Bye.
Thank you.